What if I told you that the key to saving a 150-pound dog's life isn't memorizing some dense veterinary textbook,
Right. Yeah, definitely not a textbook.
but it's actually just paying attention to how they get off the couch on, like, a random Tuesday? Picture an ordinary morning in your house.
Okay, I'm picturing it.
You're standing there, holding a coffee mug, and your dog gets up, stretches,
Mm.
walks to the back door, and eats breakfast. He takes a long drink of water, looks outside, you call his name, and he just ambles over.
Yeah, it sounds like the most uneventful morning imaginable. Just a completely standard Tuesday.
And that is exactly the point. Because you, as the owner, you're noticing crucial things without even really trying anymore.
Exactly. You're passively gathering data.
Right. You notice how fluidly he got off his bed. You notice whether both of his back paws cleared the floor cleanly when he walked. You see how fast he demolished his breakfast and, whether his breathing settled back down into a slow, steady pace after his walk.
Mm.
You run a hand along his side to give him a scratch. And you feel that his ribs and his waist feel the way they usually do. You notice one nail looks a little more worn than the others.
Right, just these tiny little details.
Yeah, and maybe there's a small fatty lump on his shoulder you've been tracking, and you mentally note that it feels, well, identical to last week. He settles down, totally comfortable, and you just go about your day. Nothing dramatic at all.
It's incredibly mundane, but that picture you just painted is actually the gold standard of canine healthcare.
Really, just paying attention.
Yeah, because none of those tiny details mean anything dramatic in isolation.
Mm-hmm.
But when you weave them together, they form a complete vital picture of a giant breed's internal health.
Okay, let's unpack this. Because if you have a giant breed, specifically like a Great Dane, you already know the intense medical anxiety that can just sneak into your daily life.
Oh, absolutely. The anxiety is so real.
Because these are massive, deeply sensitive dogs with some very specific, genuinely terrifying health risks. So today's deep dive is taking vast amounts of veterinary and behavioral advice from this really comprehensive 10-part framework.
Right. We're pulling from a lot of sources today.
Yeah, and we are distilling it down into one highly practical mindset. The mission for you today is to learn a repeatable, completely stress-free system for keeping tabs on your giant breed without, becoming paralyzed by fear every time they sneeze or stumble.
A stress-free system is the perfect goal, honestly, because the most useful health checklist for a Great Dane owner isn't a list of horrifying diseases to stay up late Googling.
We've all been there at 2 a.m. on WebMD.
Right. But it shouldn't be that. It's simply a reliable, objective way of comparing today's dog with yesterday's dog.
Well, to do that effectively, we have to start by laying down the intellectual foundation. Before we even touch on specific body parts or diseases, the sources establish 3 core principles for how you should observe your dog.
Mm.
And the very first one is simply know your dog's normal.
Which sounds like super generic advice, right? But it is deeply profound when you actually apply it.
How so?
Because you absolutely cannot recognize a meaningful change in your dog's appetite or their movement, breathing, or behavior if you don't already possess a crystal clear sense of what is typical for this specific individual dog.
Right, because every dog is different.
Exactly.
Yeah.
And crucially, that normal is always a moving target. I mean, a puppy's normal energy level and gait is completely different from an adult's normal.
Oh, for sure.
And an adult's baseline is wildly different from a senior's. So you have to keep updating that baseline.
So you're not chasing some idealized textbook definition of like a perfect Great Dane. You're just setting a localized baseline for the creature living in your house.
Spot on.
Which leads directly to the second principle, which is that trends matter infinitely more than single moments.
What's fascinating here is how qualitative trends will always trump single, isolated data points.
What do you mean by qualitative trends?
Well, think about the bathroom scale at the vet's office. A Great Dane's scale weight can remain perfectly, identically stable at, say, 145 pounds for 6 months straight.
Okay, yeah, that sounds healthy.
Right. If you only looked at one quantitative metric, you'd assume their health is holding steady. But underneath the skin, a senior dog might be quietly losing significant muscle mass along their spine and their hindquarters.
Oh, wow.
Yeah, and that lost muscle is simply being replaced by fat or fluid retention. So the scale actively hides the truth.
That is wild to think about.
But a persistent qualitative trend, like the dog suddenly needing 3 attempts to turn around in a narrow hallway over a 3-week period, that tells you exactly what is actually happening to their body.
Right.
One stiff morning means absolutely nothing. Maybe they slept in a draft.
Sure.
But stiffness that keeps showing up every single morning, That becomes actionable data.
That distinction between data and noise is so helpful. Which brings us to the third core principle, and that is to observe without diagnosing.
This is so important.
Yeah, when I read this part of the framework, it immediately sparked an analogy for me. As a dog owner, you're not supposed to act like a meteorologist who is desperately trying to build, a complex predictive model of an incoming hurricane.
Right, you don't need a PhD in atmospheric science.
Exactly. You don't need Doppler radar. You are just the frontline weather reporter. Your only job is to look out the living room window, call the vet and say, hey, it's hailing and the wind is blowing east.
I love that framing. Leave the heavy diagnostic lifting to the professional with the medical degree.
Seriously.
You are not trying to definitively identify wobbler syndrome or osteosarcoma, hip dysplasia, osteoarthritis from your living room sofa. That path only leads to panic.
Oh, absolute panic.
Your job is to describe what changed, exactly when it started, what physical actions make it worse, and, if any other weird quirks started happening at the exact same time. You gather the raw facts, and the vet connects those facts to the pathology.
So let's pull this out of the abstract and put it into practice. We're moving from the principles of observation into the physical application, which means the daily visuals and the weekly hands-on checks. Let's tackle the daily visuals first.
Sounds good.
So appetite is obviously a massive indicator.
It is, but the framework insists we look at the nuance. It's not just a binary did they eat. It's looking for extreme frantic hunger versus a subtle reluctance to finish the bowl.
Like how they are interacting with the food.
Yes. Are they chewing differently? Are they dropping kibble out the side of their mouth? And there is a very important caveat here for giant breeds. A strong appetite does not prove complete health.
Yeah, the sources made a major point about that, specifically regarding dental pain.
It's a huge misconception.
Because a dog will frequently suffer through an agonizing broken tooth just to eat their dinner. Their survival drive completely overrides the pain, so a clean bowl doesn't necessarily mean a pain-free mouth.
Exactly the opposite of what most people assume. We also need to monitor water intake and urination daily. And this is vital for behavioral context.
Oh, this part was fascinating to me.
If a previously rock-solid, house-trained Great Dane starts having urinary accidents in the house, that is rarely just sudden defiance or bad behavior.
Right.
It is almost always a waving red medical flag. It could be urinary tract issues, subtle kidney changes, or even a mobility issue where, their hips hurt too much to get up in time to ask to go out.
And behavior changes in general, like sudden clinginess or isolating themselves in another room, or maybe a low growl when they shift positions on the couch.
Yeah, any of those.
Those behavioral changes can be rooted in medical pain just as easily as they can be training regressions. But I do have to push back a little on the next part of the framework, which is the weekly hands-on check.
Okay, let's hear it.
The sources strongly suggest actively checking the dog's ribs, feeling the waist tuck, and palpating the muscle mass over their shoulders and thighs every single week.
Right, a weekly physical.
Honestly, doesn't doing a full-body physical exam on your dog every 7 days turn you into a massive helicopter parent? I mean, if I'm poking my dog every week, aren't I just going to hyper-fixate on every little fatty tumor and totally freak myself out?
That's a fair question.
Doesn't this constant prodding cause the exact medical anxiety we're actively trying to avoid here?
It's a very natural assumption to make, that looking for trouble means you'll constantly feel anxious about finding it. But the psychological reality is actually the reverse.
Really?
Because of the Great Dane's short single coat, this physical check is genuinely effortless. You can do the entire thing in 60 seconds while just giving them affection on the couch. Establishing this tactile routine actually prevents anxiety.
I'm still skeptical. How does poking a lump prevent anxiety?
Because anxiety thrives in a vacuum of information. Imagine you were just petting your dog and you suddenly notice a lump on their shoulder. If you haven't done a physical check in 6 months, your brain immediately goes to the worst-case scenario. You panic. Is it an aggressive tumor? Did it grow to the size of a golf ball overnight?
Right, because I have no baseline.
Exactly. But if you do a casual weekly check, you operate on a foundation of familiar facts. Say, oh, there's a lump. But I know for an absolute fact it was not there last Tuesday, so it is brand new. And I know exactly how big it is right now.
Okay, that makes sense.
You are operating on concrete data rather than sudden, fearful guesses.
Okay, when you put it like that, it makes a lot of sense. You're not looking for trouble, you're confirming normalcy so that when trouble does appear, you actually have context.
Precisely.
And the sources give really specific advice on how to feel for things. Like for the ribs, it shouldn't just be a visual check.
Right. Visuals fail us when a dog gains even a little bit of weight. You need tactile feedback.
How should it feel?
When you run your hand lightly over a Great Dane's rib cage, it should feel like the flat back of your hand. You can feel the distinct bones, but they are covered by a smooth layer of skin and tissue.
Okay.
If their ribs feel like your knuckles when you make a fist, the dog is far too thin.
Wow, okay.
And if it feels like the fleshy base of your thumb, they are carrying too much weight, which is absolutely devastating for giant joints.
And speaking of lumps, the golden rule in the sources is to record the specific location and the approximate size, maybe compare it to a pea or a grape, but never squeeze, pinch, or aggressively poke them.
Gather the data. Do not agitate the tissue.
Why is that so dangerous?
If it happens to be a mast cell tumor, squeezing it can actually cause it to release histamines into the bloodstream.
Oh, wow. Wait, really?
Yeah, it can trigger a severe allergic reaction. Just note the size and leave it alone. Let the vet do a fine needle aspirate if needed.
Got it. Now, there was one highly specific detail in this physical check that absolutely blew my mind. The nails. Obviously, you check for cracks or overgrown length, but the sources specifically highlight checking for rear nail scraping.
Yeah, checking to see if the tops of the back nails, like the side facing the ceiling, are wearing down abnormally fast.
I had no idea about this. Why is looking at the top of a toenail so critical?
Because a stoic Great Dane might not show you a severe, obvious limp right away, but if their rear nails are scuffed, scratched, or worn completely flat on the top surface, it means they aren't picking their back feet up all the way when they walk.
Oh, I see.
They are dragging or knuckling their toes. That is a massive, early, highly objective clue to a neurologic issue, often something called Wobbler's syndrome.
And Wobblers is an issue in the neck, right? Not the back legs.
Exactly. It's a compression of the spinal cord in the cervical spine at the neck.
Right.
That compression interrupts the nerve signals traveling down the spine, creating a literal disconnect between the brain and the back feet.
So the signal just gets lost.
Yeah, the brain says, lift the foot, but the signal gets scrambled, so the foot drags. The nail scraping tells you there's a neurological disconnect long before the dog entirely loses the ability to walk.
That is just brilliant. Okay, so we have our baseline established, but as we discussed earlier, normal is constantly shifting. Let's move into navigating the different life stages and the hidden breed-specific risks that start to pop up as the dog ages.
Right. Puppyhood is the first major developmental hurdle. And the biggest takeaway for giant breeds here is, whatever you do not race toward maximum size.
The sources explicitly state you must avoid calcium and generic growth supplements unless specifically directed by a veterinary nutritionist. People think more calcium equals stronger bones, but that's a dangerous myth for giant breeds.
It's incredibly dangerous. If you pump a Great Dane puppy full of excess calcium, you hyperaccelerate the growth of their bones.
Which sounds good in theory, but...
Right, but their soft tissues, the ligaments, tendons, and muscles, they simply can't keep up with that rapid skeletal expansion. The biomechanical structure becomes fundamentally unstable. Fast growth invariably equals fragile growth, leading to lifelong orthopedic issues.
Then they survive puppyhood and hit adolescence. The vital thing to remember here is that a Great Dane's body looks like a fully grown, intimidating adult well before their brain's judgment actually catches up.
Oh, yeah.
You basically have a 120-pound creature with the emotional regulation and impulse control of a toddler.
Which means consistency in training and environmental management is crucial, simply so they don't accidentally injure themselves or knock someone over in a burst of enthusiasm.
Eventually, they transition into the senior stage. The framework offers a beautiful golden rule here. Never measure a senior dog's daily walk against their younger self's performance. A shorter, drastically slower sniffing walk is still incredibly valuable to their mental health.
And as they enter those senior years, we really have to talk about the hidden breed risks. Heart health takes a major spotlight. Great Danes are heavily predisposed to conditions like DCM, dilated cardiomyopathy.
And the warning signs aren't always like a dramatic clutching the chest heart attack like you see in movies.
Huh?
It's unexpected fatigue, it's unexplained weakness, it's suddenly fainting or collapsing during normal play.
To understand why, you have to look at the mechanism of DCM. The heart chamber physically dilates. It stretches out and becomes enlarged.
Right.
As it stretches, the heart muscle wall becomes dangerously thin and weak. kind of like an overused rubber band that has lost its snap.
That is a terrifying visual.
It simply cannot pump oxygenated blood effectively anymore. So if that dog tries to go for a brisk walk, the brain gets starved of oxygen for a split second and the dog faints. If a giant dog can't handle a walk they normally breeze through, that pattern needs to go straight to a cardiologist.
But the cancer risk highlighted in the sources is perhaps the most insidious threat of all. Here's where it gets really interesting, in a deeply terrifying way. The framework highlights osteosarcoma, bone cancer. And the mind-blowing part is how it often disguises itself initially as just a simple, mild, everyday limp.
If we connect this to the broader reality of the Great Dane's anatomy, giant bodies are incredibly adept at hiding major internal changes. Their skeletal structure is just massive.
Yeah.
So a tumor can be literally eating away at the bone from the inside out, replacing solid bone matrix with frail tumorous tissue. The structural integrity is being destroyed, but because the dog is so large and stoic, they just show a slight hesitation on the stairs.
Which brings us right back to the trend rule. 1 day of limping. Maybe they stepped on a sharp rock in the yard. 3 straight weeks of intermittent limping. The frontline weather reporter says it's time to call the vet for x-rays.
Because that hollowed-out bone is a ticking time bomb. What happens with advanced osteosarcoma is that the bone becomes so fundamentally weak that a sudden severe lameness from a minor trip, like they just stumbled off a sidewalk curb and suddenly can't bear any weight, might actually be a catastrophic spontaneous bone fracture.
Wow.
Yeah, the bone simply snapped because it was already hollowed out by the underlying cancer.
That is intensely sobering, but it's so empowering to know. You patch the persistent limp, you take the x-ray, and you find the cancer before the bone breaks in half.
Exactly.
Now, we've spent this entire deep dive focusing heavily on playing the long game, monitoring gradual trends, watching for subtle changes, and waiting to see. But let's completely flip the script. There is one terrifying scenario where waiting for a trend to develop is a fatal mistake.
GDV, gastric dilatation volvulus, universally known as bloat.
The ultimate nightmare emergency for giant breeds. The sources make it undeniably clear that this deserves the strongest focus of any health checklist. The warning signs are specific, repeated, unproductive retching. They look and sound exactly like they need to throw up, but absolutely nothing comes out.
Yes, that is the hallmark sign.
Add to that severe restlessness, frantic pacing, drooling, and obvious abdominal pain.
And the most critical piece of advice in the entire framework, do not wait for visible swelling.
Really? Because you always hear about the stomach swelling up.
By the time a giant dog's abdomen is visibly distended like a drum, you are already losing precious, irreversible time. The stomach is filling with gas and twisting, compressing major blood vessels like the vena cava, which stops blood from returning to the heart. If you see unproductive retching and extreme panicky pacing, you move immediately.
There is absolutely no home treatment for this. You never try to induce vomiting. You don't offer gas pills. You go straight to the surgical emergency room. But I want to pause and clarify something the sources stressed, because there is a massive, dangerous misconception out there about gastropexy surgery.
Yes, the preventative stomach tacking surgery. A lot of owners opt to have this done when the dog is young, often during a spay or neuter.
Right, and people mistakenly think a gastropexy makes their dog immune to bloat. But the sources are explicit. A gastropexy surgically attaches the stomach to the abdominal wall. This drastically reduces the risk of the stomach twisting the volvulus part. But it does not prevent the stomach from filling up with gas, distending, and causing immense abdominal pain.
Think of it like nailing a balloon to a wall. The balloon can't spin around anymore, but it can absolutely still inflate until it's dangerously tight.
That's a great analogy.
The warning signs of unproductive retching and pacing still apply completely. A gastropexy buys you a little extra time to get to the surgeon, but it does not buy you a free pass. You still have a life-threatening emergency.
Which brings me to a highly practical, logistical question on behalf of anyone listening right now. If this happens at 2 a.m. on a Sunday, and you have a 150-pound dog who is in agonizing pain, actively collapsing, and completely refusing to walk, how do you physically transport them to the hospital?
This raises an important question about what holistic emergency preparedness actually looks like in the real world. Medical knowledge is entirely useless if you fail at the physical logistics.
Exactly.
The framework insists that you must practice ramp use and vehicle entry with your dog when they are healthy, happy, and capable. You need to know for a proven fact that your current vehicle can physically fit an adult Great Dane who cannot bend their legs easily.
Because at 2 a.m., in a blind panic, you cannot be trying to deadlift 150 pounds of agonizing, uncooperative weight into the high back of a small SUV by yourself.
You simply can't. Holistic prep also means knowing exactly which 24-hour emergency hospital is actually open and staffed for surgery at 2 a.m. on a Sunday. Have the route mapped in your phone.
Good point. Not every vet is a 24-hour surgical center.
Right? Know which neighbor or family member you can call to help you lift the dog in a makeshift blanket stretcher. And, critically, have your financial safety nets pre-calculated.
We have to acknowledge the financial reality. GDV surgery is phenomenally expensive, often running well into the thousands. You need to intimately understand what your pet insurance actually covers or, have a dedicated emergency savings account ready to go.
Right.
You aren't forced to make life or death financial decisions while your dog is collapsing in the waiting room.
It all comes down to removing every possible friction point before the crisis hits. When the adrenaline spikes, you just follow the plan you already built.
Which is a heavy, intense topic, but it transitions beautifully into the final section of our sources. Because ultimately, the entire purpose of all this diligent tracking, the daily visuals, the tactile weekly checks, the intense emergency prep, it isn't just to stubbornly drag out the dog's life for as many calendar years as biologically possible.
Definitely not.
The goal is to ensure the dog's life is actually meaningful, engaged, and comfortable.
Quality of life. It is the absolute emotional center of this entire framework.
The sources make a poignant observation that end-of-life planning and having those undeniably hard conversations with your vet before a catastrophic crisis forces your hand is not a form of giving up.
Not at all. It is the ultimate act of stewardship. You are taking on the emotional pain so the dog doesn't have to experience the physical pain.
Wow. Yeah.
And conversely, continuing to provide adaptive care while the dog's quality of life remains genuinely good is not selfish.
Yeah.
It's an individual, highly personal decision made at the right pace for your specific family.
And a huge part of that is redefining what a good life actually looks like for a senior giant breed. Quality of life isn't just about whether they finish their breakfast. If a 12-year-old Dane can't hike 3 miles in the woods anymore, that doesn't mean their life is empty.
Absolutely not.
A dog doesn't need youthful, athletic performance to have a great day. A short, incredibly slow sniffing walk where they get to read the neighborhood P-mail, experiencing deep, comfortable sleep without joint pain, and simply resting quietly near the people they are bonded to. That can be more than enough.
It becomes about comfort, social connection, and the dignity to rest peacefully. If they have those things, that is a wildly successful Tuesday for a senior Dane.
So what does this all mean? When you step back from the micro details and look at the whole picture, it's pretty incredible. We've traced the historical journey of this breed. They started out centuries ago as powerful German hunting dogs, bred for raw strength, explosive speed, and the sheer courage required to hunt wild boar.
Yeah, true working dogs.
And now, today, they have evolved into deeply attached, highly sensitive, almost fragile companions living inside that enormous historical body.
And treating the dog properly means honoring both of those realities simultaneously. You have to respect the intense biomechanics and the outsized medical risks of their giant physical frame, while constantly catering to their deeply sensitive, emotionally attuned nature.
You're managing the heavy-duty chassis of a truck, but it's running on a highly sensitive, emotional operating system.
That tension is exactly what makes giant breeds so special and, honestly, so demanding.
So let's recap the mission we accomplished today. We have successfully built a stress-free framework for observing a giant breed. You start by establishing your specific dog's normal baselines.
Yeah.
You rely heavily on persistent trends rather than panicking over isolated moments. You adapt your expectations to their life stages, from the fragile, rapid growth of puppyhood to the slow grace of their senior years. And you lock down an ironclad, physically practical GDV emergency plan so you never have to guess in the dark when minutes count.
And the true beauty of this system is that by doing all this routine observation when things are calm, noticing a real medical change eventually feels entirely natural, not overwhelming. You're simply comparing today's dog to yesterday's dog.
We want to leave you with a final thought today, something to mull over on your own. Given how much profound medical insight we can gain about our dogs just by quietly observing their tiny micro-habits, noticing how fluidly they rise from a nap, how long it takes their heart rate to settle, or how they shift their weight to avoid discomfort when they stand. What might someone learn about our unspoken physical health or our hidden emotional stress levels if they observed us with that exact same intense, non-judgmental attention?
It's a sobering thought. We definitely tell on ourselves and our daily habits just as much as they do.
We really do. But for now, just enjoy your morning. Watch your dog walk to the door, watch his back paws clear the floor, and take deep comfort in knowing exactly what you're looking at. Thanks for joining us on this deep dive.